This is a great day for U of L, for U of L Athletics, and U of L Health, all coming together to do this, make this wonderful announcement. I'm glad to see all of you. I didn't expect this crowd, but it just shows how important athletics is and how important our healthcare system is to our community. So we're bringing together two important parts of our Cardinal community, and that will be to the benefit of our student athletes. Our student athletes give their all for U of L every day, all day long. So we owe them the very best health care that they can get. We know a student that gets great health care and great training in the training room performs better. Students that perform better have a little bit less stress. They may do better in their academics. And we already know that we are a jewel in terms of the athletic performance of our students and their academic performance. Last year, our student athletes graduated at a 91% graduation rate. That is phenomenal. It's a testament to the staff in athletics and to the strength of our athletes. So, you know, this notion of U of L Health providing the health services for our student athletes isn't new. Early on, Jewish Hospital did that for our students. And then about, 4 years ago? Thank you. 4 years ago, we acquired U of L Health and Jewish, and we made our U of L Health system, which is really strong and made such a difference in the community. Last year alone, they saw over 1 million patients, and you can imagine during COVID, if we hadn't had U of L Health, what would have happened to the city of Louisville and our surrounding area. So it's another jewel in the crown of Louisville, the city. So when we acquired a Jewish again, we got our sports medicine program back, and it's just grown in strength since that time. I will tell you, I know that it's going to be great because my physician, Dr. Jen Daly, is going to be leading it, and look at me, what shape I'm in. So that's going to be great. So we want to make sure that we continue this partnership. U of L Health is a separate entity, but it bears our name. U of L Athletics carries the banner of the bird, and we want to make sure that our student athletes have the most wonderful opportunities to learn, to play and excel on the field, in the pool, on the track, on the court, and this is just one step to allow that to happen. I cannot wait to see the U of L Health banner at our sporting venues to show that we are all together in this for the betterment of our students and for the betterment of our campus. So Tom, I thank you. Jen, thank you. And of course, Josh, I thank you. And I'm going to introduce Josh Hurd, our athletic director.
So I'm going to continue that theme with some thank yous here and start with our staff. Dr. Pat Ivy, Dr. Blake LeBlanc. I introduced him somewhere, and I did not introduce him as doctor, and he let me know that. So Dr. Blake LeBlanc, our entire sports medicine team, thank you. Thank you for everything you do every day, but thank you for helping put this partnership together. Tom, Brett, Dr. Daly, thank you so much. There's nothing more important to our student athletes than their health, physical health and mental health. In order for our student athletes to achieve their dreams, they will push their bodies and minds further than they have ever pushed them before. We know they're going to push themselves to the limit. Thus, we have an obligation to provide each of them with the best possible health care that we can. As we began conversations with U of L Health, we were very direct in asking them for a significant commitment in order to provide our athletes with what we thought was needed in order to provide the best possible health care coverage that we could. I'm confident in saying our student athletes will be in good hands for years to come. A few examples of that commitment. U of L Health will provide direct funding and staffing to create a mental health team that will provide our athletes with access to 10 mental health professionals. While I don't have specific data for the support provided around the country, I'm confident in saying very few, if any, athletic departments will be able to provide this kind of support around mental health. This was extremely important to our coaches, our staff, but most importantly, we were told by our student athletes that mental health had to be a priority. It was. U of L Health will provide access to their entire network of doctors, surgeons, nurses, facilities, and specialists in order to care for our athletes. U of L Health has also made a commitment financially. They will provide our department with annual dollars to help upgrade our athletic training and sports performance facilities. They will help supplement the salaries of our athletic trainers. They will continue to support our sports science department so that we can continue to learn and adapt our techniques relative to each of our individual sports. This partnership is an example of how this university can strategically use its resources to collaborate and create a win-win for all involved. In this case, our student athletes will be receiving an unprecedented level of health care, and at the same time, the U of L health system will be given the chance to work with some of the best athletes in the world. This partnership reminds me of the old saying, give your time, your talent, or your treasure. Rarely do you find a partner who's willing to give all three. U of L has made that commitment, and they did it because they wanted to help our student athletes in our department. They wanted to help this university succeed. With that in mind, we're extremely excited to announce this partnership with U of L Health. We're confident this partnership will provide our student athletes with the care they need and deserve as they represent this great university. With that, let me introduce the CEO of the official healthcare provider of U of L Athletics, Tom Miller.
President Gonzalez, Josh, thank you very much. You know, I feel like what a great place to be. And I think it's time for a pickup football game on the stadium. We're about 60 days away from being in here to watch a championship year for the University of Louisville. So I thank all of you for being here. Pat, you're not invited to the game. Sorry. You know, U of L Health is a unique resource for our community and the entire region. And we're excited to officially join the U of L University Cardinal team and athletics. We think it's a great and a perfect fit for us. Academic medicine is truly a team effort, as is the resources that are used by our student athletes. It takes world-class efforts, both on the field and off the field, to make a difference in the health of the student athletes. And we at the University of Louisville Health take on the most complex cases. We develop innovative treatments, and we're breaking down barriers to provide care throughout and provide access throughout our community. Athletes represents also a unique set of patients. And when Josh talked about the health of those athletes, he's not just talking about what happens when they get hurt. He's talking about the mental health. He's talking about the nutritional health. He's talking about the researchers who try to keep and make sure these athletes don't get hurt in advance. And that's what we're hoping. We have one goal with the university, which is to make sure our student athletes are healthy, to make sure that they can perform at the highest levels that they can. The pressures that go on in being in school is difficult enough as opposed to the expectations that we have as they're on those fields. And our goal is to try to make sure that we provide the marrying of those aspects of giving them great health, of giving them great nutrition, of giving them perfect mental health associated with it. And we want to do this together as a team and be an example for the ACC of what a great sports medicine program is about. Injuries, when people are off the field, those student athletes want to get back on the field. They want to make sure that they have the best health associated with it. And we have a team of 850 providers who are going to help associated with that. You know, when we look at U of L Health, we have, with all of these providers, we really focus on sports medicine and primary care providers. We're focusing on trainers, physical therapists, emergency team, orthopedics, neurologists, cardiologists, ophthalmologists. That is a team effort to try to keep these students healthy. Together, we will ensure that world-class Cardinal athletes have the best world-class health care in the area. Teaming up is a part of the overall game plan for growing U of L Health. As we've looked at our community, we are expanding University Medical Center to modernize that facility. We are committing to beds up in Bullitt County. We have added ICUs in Shelbyville, and we continue to look at ways that we can make a difference in the care of patients. But this doesn't happen alone. I just want to call out a couple of our team members. Brett Hayes, who has come and helped make a difference associated with it. Dr. Jen Daly, who truly is trying to lead 830 doctors with one cause, a miraculous effort. Dr. John Becker, who's chair of the Department of Family Medicine, who is here. Ernie, John Walsh, Kathy Spalding from Fraser Rehab, Wade Mitzel. It is a team, and we've been working for 3 years to try to put together a team to make a difference in the care of these student athletes. And we're proud to be able to accomplish that today in this partnership that we're going to have. I want to call up a person who is truly making a difference associated with leading this, and that is Dr. Jen Daly. She's best known for being Dr. Gonzalez's primary care doctor, but I think she's also best known for leading a group of doctors to truly make a difference in the care of these student athletes and keep them healthy. So, Dr. Daly.
Thank you so much. Good morning, everybody. I'm Dr. Jen Daly, the Medical Director for Uville Health Sports Medicine, and it is my honor and privilege to be here today. This is a very exciting day. It's been in the works for a while now, and it feels really good. And as everybody here has spoken to, we're in it for our student athletes. Like, that's why we sign up. That's why I have the best job in the world, is I get to care for these elite, high-performing individuals who trust me with their health care, which is an honor and a privilege, but I can't do it alone. On behalf of the sports medicine team, which is a big team, I didn't get here by myself. Lots of people helped get me to this point. We are so excited to have this official announcement of a renewed partnership with the University of Louisville Athletics. As providers, our goal is and has been to provide the best preventative care for our student athletes. We want to keep them healthy. We want to keep them free from injury. We also want to set the foundation of a lifetime of good health. So when they leave here, they continue in good health. They know what to do to keep themselves healthy. We also want to help them provide at their highest ability. And if they have an injury or a diagnosis that needs attention, we want to get them to the very best specialist possible who can provide expedited care leading to their quick recovery. So that's what our team is, and that's what our goal is. And while our primary care sports medicine team has been serving UofL athletes for 16 years, our goal as we created this new agreement was to distinguish sports medicine care, not just at the University of Louisville, but within our region and within the NCAA. Working with our UofL Health Sports Medicine team and our partners at the university, we have developed a plan focused on the following. And much of this has already been spoken to, but I'm just going to talk about it one more time since I'm the wrap-up. So first, expanded specialty care. So as Tom talked about, we've assembled a team of UofL Health's best providers from every specialty who could join us to provide high-level, seamless, expedited care to our Division I athletes. This new UofL Health Sports Medicine team includes more than 100 providers dedicated to sports medicine, from orthopedic surgery to diagnostic imaging, emergency medicine, cardiology, and many, many more. Second, mental health and performance. In our world today, mental health care has become incredibly important to all of us. I think everyone here knows that and feels that after this pandemic. But especially for our young athletes in the academic and sport world, having mental health support is necessary and critical. In partnership with UofL Athletics, UofL Health, we've created a model of care that is unique and we believe will better support our athletes. Our new Director of Mental Health and Performance is actively forming her team, and that'll be in place soon. Third, bringing together our academic institutions and healthcare. With research and innovation in mind, we started by hiring our new Director of Sports Science. We're working with various departments across both the Belknap and Health Sciences campuses to collaborate on research initiatives. We're also incorporating technology with traditional therapy and performance models. We're using DARI motion caption systems, a platform that can be used to improve athletic performance, and so much more. And lastly, sharing this model with our high school and community athletes. We are committed not only to UofL Athletics, but also to the community in which we live and provide care. So whether we are on the sideline of a local high school game or community event, we want all athletes we care for to have access to the same comprehensive model of care as our Division I University of Louisville Cardinals. Our intent is to offer access to the same array of specialists, to make available the same level of mental health and performance, and to incorporate research and technology into the care and to provide all of our sports medicine patients, whether they're in high school, college, or in a community event. I personally do want to also thank Tom and Dr. Gonzalez and Josh for their support, their belief in this team, this belief in this program. We wouldn't be here without everyone in this room. So I thank all of you. I can't name all of you. We'd be here all day long. But thank you very much, and go Cards.
We now have time for a few questions. If you guys have a question, raise your hand, and a microphone will be brought to you. And we have questions for Josh or Tom.
Question for Josh and for Tom. The release mentions that this is an 8-year deal, but it's a little short on specifics on the financial end that you alluded to. I wonder if you could elaborate on that. And for Mr. Miller, whether you could maybe give us a sense for what the value of this contribution or commitment is to U of L Health.
Well, let me first say, there is no price tag that you can put on keeping student athletes healthy. I mean, the most tragic situation is when someone has an injury on the field that could have been prevented or that could have been taken care of differently. And so there's no value that you can put on. But when we talk about this, you know, what we're contributing to the university is resources so they can put together athletic trainers. Josh talked about the 10 mental health providers that are helping for those student athletes, the nutritionalists, the physicians. The full contribution that we're making is about $3.5 million in resources available. Some of that will go to additional equipment in the athletic training areas associated with it. But the commitment that we've made is not just to the university. We have 11 high schools that we hope would also be able to benefit associated with this. We'll be providing services to the stadium here. There's 5 first aid resources here, so we'll be providing resources associated with that. It's a full commitment that we have to a partnership with the university and the health of this community. And again, it goes beyond just the student athletes that are here at the university. It goes to those high schools who also need those resources associated with it. And the ability for us to take those resources and bring them together can really make a difference. And we're trying to make a difference in really using university as an example of what great sports medicine is. So there's not a value that I would put on this, except that it's invaluable in order to help the university and help these student athletes and those high schools.
$3.5 million, is that over 8 years or is that annually?
That would be annually.
Thank you.
For Josh, can you speak to the day-to-day operation, and will there be any changes that the student athletes notice, and kind of just how you make a transition like this with so many student athletes, so many teams?
Yeah, I feel like I should call Dr. Ivy and Dr. LeBlanc up here to answer that question. That was one of the discussions. We've had a lot of discussions as to, quite frankly, how we continue create that continuity of care that we have created, but get it better. So I hope our student athletes notice some differences. I hope they realize that it's better. And that's really from the resources, because we had a really good agreement. We had a really good partner. But really the number of resources that are being provided now, I would hope, and I think that our student athletes will see an impact there. You know, day to day, you talk about all the things that are provided here. You know, do we have an opportunity to hire some more trainers, do some different things like that? We do have the ability to do some things like that. So yes, there's going to be an impact. I think it's going to be fairly immediate. Now there's also, we have to ramp some of this up. Kate and her team, you don't have those 10 mental health professionals in your back pocket yet, do you? Close. So that's I do want to set expectations there with our coaches and our student athletes that this is going to take us a little bit of time, but we're going to get there. And I fully believe that we're going to be a model for the ACC and around the country to have one of the best sports medicine programs in the country to take care of our student athletes.
Josh, you've more than once made reference to the priority of mental health. What has raised your concerns in that area, and do you see a problem that has been exacerbated in recent years?
I think if you ask nearly any one of our student athletes, if you ask any one of our coaches, if you ask a large number of our staff members, support staff who work with our student athletes, they would tell you that we had to have resources put towards mental health. And I think if you asked Lori or anybody on the university side, she would tell you the same thing about the general student body. And we've seen some of those really tragic stories around the country. And we have to make sure that that never happens here. And so, yes, we were very committed to that. That was priority number one for us as we started talking about a partnership. Like I said, the amount of times we talked to individual student athletes who just said, the pressures that we feel every day are significant, and we need help dealing with that. So, absolutely, it was very, very important.
Just kind of following up on that, with the 10 mental health professionals, can you clarify, are those therapists, or what kind of actual resources are those?
That is up to Kate here, Kate O'Brien, who's our director of mental health, and so I don't have the answer to that question, but I'm sure she could give you a little bit more clarity as she's starting to put her team together.
Further questions? Thank you all for coming. Appreciate it. Thank you.
Thank you.
Thanks again.
Yeah, no, I'm excited. Good day. Good day. Really good day.